Well, hello. This webinar is on how to keep stress out of your pelvic floor. I am Gina. So I'm a pelvic floor occupational therapist. I'm based in Denver and I have a Denver clinic, anxious pelvis clinic, where I provide pelvic floor therapy. And I'm also an online educator and coach. So the anxious pelvis is all my online education and coaching. And I'm very nervous system based, trauma informed, holistic. I also have training in sex counseling and really take a lot of whole body approaches and focus more on the connection of the mind and the body while still including all of the other good stuff that goes into pelvic health. So just a little recap of what we're going to go over today. So we'll talk about just an overview of the pelvic floor, how the pelvic floor is related to stress and anxiety. And I just realized I think I spelled anxiety wrong. Practical strategies, how to, for the most accessible and impactful strategy that we'll talk about. So we'll go over that one together, how to learn more, and any questions. A little disclaimer, especially, we're all talking within a space of liability. The information in this webinar is for informational purposes only and is not to be taken as medical advice. Always encouraging you to consult with your doctor before using this information, and seek the advice of those medical providers or other qualified health providers with any questions you may have regarding your physical, mental, or emotional health. Okay, so what is the pelvic floor even to begin with? And if you guys want to actually just put into the chat, I'm curious where people lie on their understanding of pelvic health, on what the pelvic floor is. You can put maybe a scale of 1 to 10. How much do you understand the pelvic floor or pelvic health? 6, okay? All right, not sure. Okay, keep coming in with those. Um, Okay, so everybody has a pelvic floor. And that's something that is crazy enough not always realized. People think it just kind of has to do with women or pregnancy, but so much is involved in our pelvic health. And the pelvic floor is this base of muscles, this bowl of muscles at the base of your pelvis. If you kind of feel the bony prominence in the front of your body, that's your pubic symphysis. So on these pictures, that's right here. And so this picture, these are as if you're looking down onto the pelvic floor. And the sides, so you have your sits bones on the side. So if you have your hand under your butt, you can kind of feel a little bony prominence there. The pelvic floor is in between there. And then your tailbone is in the back. So that's where the back of the pelvic floor is connecting. So it's kind of this diamond shaped bowl. It's not crossing over any joints like other muscles do. So it can be a little harder to know what's going on with the pelvic floor. It takes a little bit more awareness, but it is supposed to just function for us in the background. And with these pictures on the left here, this is a pelvis that would have a vaginal canal. And then this one would be one with penile anatomy. And then here's just a different view. So you can see that there's all these organs that sit tightly knit inside of the pelvic floor. Pelvic floor is going right here. And same thing over here with different anatomy. The pelvic bones are stretching all the way across here. So even your low back, that sacrum area, all of that is included in your pelvic health. So overall, what is pelvic health? It is the state and well-being and optimal function of that entire region. So this also includes your abdominals. It includes your back, really your whole body is involved in your pelvic floor, head to toe. But specifically within pelvic health too, we're talking about those pelvic bones, the ligaments, the muscles, all of those organs that are sitting inside, and any other associated structures. So inside you have your bladder, you might have a uterus, your rectum, any reproductive organs, and all of that is being supported by this bowl and controlled by your pelvic floor muscles. And so with that, we're looking at our bladder health, looking at that urinary function, looking at bowel health, how we're repooping, its fertility, its during pregnancy, it's postpartum. Also, any kind of surgery that has to do with the pelvic or the pelvic floor. It's gender affirming care, it's sexual functioning, it's also pain, any kind of sensations that you might be feeling from that low back region, even those abdominals, bladder with peeing, pooping, all of that. Okay, so what does it do? What is the pelvic floor? It has a lot of different roles. One of those are that support. We just mentioned it's kind of like that bowl. It's like a hammock, and it's supporting those organs that are sitting inside. You also have supportive layers that are supporting the openings of the pelvic floor as well as deeper. So with the openings, we have sphincteric support and roles. So basically things coming in and out of your body. So we have sphincters, thinking about like the anus, for example, poop coming in and out with the urethra, with urine coming in and out. The pelvic floor is controlling all of that. And so we want to have function of it to help keep us continent, to help us release stool and urine and just function the way that we need it to. It also has a lot of sexual functioning. It's involved in your orgasm, arousal, intercourse, and it's involved in fertility, all of that. And then stability. Sitting here listening to this call, if you didn't have a pelvic floor and a pelvis, you would just kind of flop to the ground. We need the pelvic floor to help with support when you're standing, sitting, walking, picking something up. And it's working coordination with your core and your low back, and all working together as a unit. And it also has a sump pump function. So if you're aware of this, your calves, like if you pump your calves, you might use that to help pump blood into the rest of your body. The pelvic floor is playing a similar role with your blood and your lymph to pump throughout your body. Okay, so that's just a little synopsis of what the pelvic floor is. And if you have any questions about that, feel free to send them into the chat, and I might answer them as I go or answer them at the end. So pelvic floor and stress and anxiety, what is that relationship? So stress and anxiety, they are emotions, but emotions come with physical responses. I want you guys to think of times where you've experienced stress or you've experienced anxiety, and you can put into the chat, has there ever been times where you have noticed physical body sensations? And what have you noticed in your body when you're experiencing stress and anxiety? What are some physical symptoms that you have seen? It could be something like in your muscles or in your chest. It could be even something in your bowel or bladder functioning, sensing everywhere, jaw, chest, shoulders, pelvic floor. Yeah, holding, sensing, shallow breathing, definitely. Butterflies, that's a big one. GI stress. Yeah. All of this is very in line with typical patterns that happen with more of that sympathetic or elevated nervous system of stress and anxiety. Yeah, we can have tightness in our throats, increased heart rate, breath rate. We can have increased blood pressure, and see those changes in our GI and all of that. Oops. Okay. So let's just define some of these things first. So stress, natural response. All of these are a natural response. Stress is a natural response to a difficult situation that triggers worry or tension, and it helps us. It helps us tackle challenges and threats in life. These things are not bad things in themselves. Anxiety, it's a feeling of fear, unease, or dread. It's often paired with physical symptoms like sweating or a fast heartbeat. It can be normal reaction to stress, and gives us that energy or focus. It allows us to react. But it's more so when it becomes chronic and impacts our daily life that we notice symptoms or we might want to intervene. And anxiety disorders are where this is very persistent. It can worsen over time, or it's at a significant level where it's really impacting your life, your work, your relationships, or school. So again, these things help us cope with threats. They help us respond to threats. They're not bad in themselves. However, it's more so when we get stuck in these stress responses that we can see symptoms arise, and that's where we're working from. Also, taking into account that even if you're not always experiencing like a lot of chronic stress or anxiety, but just in a specific moment. So, like maybe you have a big presentation or something, and you notice that you have an increased urge to pee. That would be an example of just how it might show up in an acute moment. Okay, so a few things to remember while we talk about this. Your brain and your body, we're always working towards survival. So, our brain's primary organizing principle is detection, prediction, it's survival. It's not wired to make you happy or successful or even to relax. It is just to survive and to stay safe. Those are the primary organizing principles. So, when we understand how the body functions, understanding this at a core helps us better understand why our body might react a certain way. Also, taking into account the pelvic health is very multifactorial. So there is a lot that goes into your pelvic health. That can be diet, it can be hormones, medical history, different chronic conditions, past injuries, medications, scar tissue, infections, what habits we engage in, and so much more. So when we talk about anxiety and stress, it can be a driver to symptoms. It can also be a contributor where other things are at play as well. And oftentimes it is multiple things at one time. But sometimes too, even if we have physical symptoms, that anxiety can heighten the response of those physical symptoms that are happening maybe from something else as the driver, or something could start as something else. So maybe there was an injury or scar tissue and we experienced pain from that. But then as time goes on, those tissues heal, but we're still experiencing pain. So that's where more of this neuro component becomes the driver. Also, keeping in mind that tension is not bad, just as anxiety and stress is not bad. We are going to get anxious, we are going to get stressed. These are normal responses. It's just a matter of not getting stuck in them. And with tension, it's more of a matter of optimizing it. Tension is really just how much tone is in the muscles. So, like, you can also have hypotension where things are just too loose and lax. And then you can have hypertension where things are too tight. But it's okay and it's normal to have moments of increased tension. It's more so, again, just not having it be something that we get stuck in. Okay, so your bladder health and anxiety and stress. So these are some examples of how stress and anxiety can impact your symptoms in terms of your bladder health. You might notice increased urinary urgency. And this is one you can especially notice in just an acute moment. Like I said, you're kind of getting ready for a big presentation or a big meeting, and oh my gosh, suddenly you have to pee. That can be that anxiety playing a role. It might not actually be a true urge that you have to pee. Pain with urination. So this, again, can very much be influenced by other things. So just because you have pain with urination doesn't mean that it's coming from stress and anxiety. And again, always getting checked by a medical provider. However, again, whether it's the driver or whether something else was there first or it's exasperating it, it can influence that pain response. And we'll talk about pain more in a moment. Urinary leaking. So a big way that this can lead to leaking. So one, if you think of like a full incontinence, so like you are feeling a really big threat and your body is experiencing a ton of stress and anxiety, that we can have a leaking response in a similar way that we experience the urinary urgency. But I also want to draw attention to the fact that tight is not the same thing as strong. So if you are feeling really anxious and really stressed frequently, or even if there's those other elements that are musculoskeletal, like scar tissue or anything like that, but if the muscles are feeling tight, Now imagine that something happened and your muscles had to hold up that pressure. They're like, oh my gosh, I can't. I'm just going to let go. Um, you are suddenly having that increased urge, but they're already really tight and they're tired. When muscles are tight, they're often tired and they can actually be weaker. So just because things are like this doesn't mean that they're nice and strong. They can actually have some weakness. So we can see increased urinary leaking with that, but again, can also be caused by other things. Um, it can also be, you might see difficulty initiating a urine stream. So remember how we were talking about one of the roles of the pelvic floor is that it's helping with the sphincters, it's helping keep things in and out. So the pelvic floor is actually relaxing and opening when we go to pee. So if things are feeling tight and restricted, and then we go to pee and we're trying to relax those muscles, it might take them a little bit to really allow themselves to let go, which would then allow that urine stream. So, by the way, we don't want to push our urine. That can strain the muscles. No power peeing. We just want to relax the muscles to release. Okay, so bowel health. Your brain and your gut, they are absolute best friends. The brain gut connection is very, very strong. You have tons of neuroreceptors on your gut. It's working in high coordination with your brain. So that can come up with chronic stress as constipation. And oftentimes we'll see with the more chronic stress, constipation, and more acute stress, so more like in the moment, you might see more diarrhea or loose stools. And that's given that there, even if there wasn't any other medical influences at play, if there was, then you might see with more of that higher acute stress, you might see more of a flare of what you typically experience. It also can be more difficult to release your stool. So think about it in the same way we just talked about releasing the urine. Those muscles, if they're feeling like it's hard for them to lengthen, and when we have a bowel movement, the pelvic floor is becoming an open door. It's a doorway. We want it to open to release that stool. So if it's having a hard time lengthening, then it can be harder to release that stool. Also, when you are in a stressed or anxious state, that is your sympathetic nervous system. So if you've heard of sympathetic and parasympathetic, it's not like sympathetic is like, always just like anxious and stressed, and parasympathetic is relaxed. There's much more nuance to it, and you can have safety in both and you can have threat in both. However, in your sympathetic, that's if we, need to run away or you need to fight something, if there was a threat in that state. And your digestion, not a priority. It is not a priority when you're trying to run away from a bear in those classic examples. So your digestion is not something that your body is going to focus on if you're chronically in a state of that stress and anxiety. So you might see more of that constipation, because constipation can show up in a lot of different ways. And when I say a lot of different ways, I mean like, how often are you going? Is it hard to release the stool? Are you straining? What is the stool consistency like? And again, very multifactorial, and what can influence that. Can also have pain with bowel movements. So if things are, one, feeling really tight and closed often, and we might associate more difficulty with that, can get some chronic fissures, which can also cause pain. And the brain remembers that. Remember, it's always focusing on that survival, that prediction. And when it remembers that, it might notice the next time it feels that pressure. Oh, I remember last time this felt painful. This might be a threatening situation. I should continue to keep some pain here. So it's a lot of this kind of both physical response of what's happening in the body, but also with pain, more so a fear component that we're associating with that sensation. Okay, sexual health. So there is so much that goes into someone's sexual experience and sexual functioning. But with anxiety and stress, we can see difficulty with insertion. So just as we're talking about with pooping and peeing, pelvic floor is that door. So if that door is feeling tight and closed off, it can be more difficult to insert. So that could be difficulty from just a tension standpoint. But it can also be something that can cause pain, but it's not so much the tension that it's causing that pain. It's more so the fear and the brain association with the touch, and with the pressure that may have started um, at one point and then kind of stuck around. Again, it can be something that's the driver, something that's just heightening things. But the pain itself is going to be more of the brain association with it. But we can also have difficulty inserting and more closed muscles if we have pain, because now the brain is like, oh, I need to protect and I need to close that off because this is something that can be threatening. Erectile dysfunction. So with arousal, orgasm, erection, all of that, and any gender and anatomy gets erections, by the way. But with that, there's also a blood flow component. So your blood flow to those organs and to the pelvic floor might be more limited. Arousal is something that's not necessarily something the body needs or wants to focus on in that moment of threat. So that can be a little bit more difficult to access. And if the muscles are feeling tense, it can be limiting that flow as well. And then pain with any aspect of that insertion, arousal, or orgasm. Again, kind of chicken or the egg of anxieties contributing to that or driving that. But that's something that you can also see come up. Okay, so with pain, I started to kind of mention the fear component with pain. So the exact equation for pain is you have a sensation. If there's then a fear, we then have pain. That's really the most simply put equation of how pain exists. Now, fear has a lot of different flavors. There are a lot of different things that can be kind of disguised as fear. And also subconscious and your conscious might think differently. And your subconscious is really going to be a huge part of what's creating this input, even if your conscious brain thinks differently. And pain can show up in pelvic health with a certain activity. So it can be with peeing, with pooping, with sitting or running or any kind of activity, or with insertion, as we were just talking about, which can be with sex, but it can also be with tampon insertion or gynecological exams and things like that. And we can also experience pain anywhere around the pelvic region. So whether that's provoked or unprovoked. So maybe there's an activity, maybe there's no activity, and we just experience that pain. We can have that around the tailbone, that can be around the low back, any of the genital region. It can be around the anus, the perineum, the hips. All of that is included in our pelvic health. And anxiety is something that can influence that pain because it's a part of this fear response, as well as contributing to that guarding. And so when we talk about the tension and the everything kind of like closing off, it's like if I had a ball just suddenly being thrown at my face, I would be like, oh my gosh. And I would jump, my body would tense up, my breath rate would likely basically stop for that moment. And I would have to react to a threat, react to the ball. Ideally, I maybe grab the ball, I catch it with speedy reflexes, and I put it down. Threat has passed. And now I might still feel a little bit activated, but now I'm going to acknowledge that the threat has passed. I'm going to do things that help that response complete. And we'll talk about this more, but that might be taking some deep breaths, noticing the tension, letting that tension go. And when I was tensing up, that was communicating to the brain, oh, she's engaging in a protective response. So if she's engaging in a protective response, like clenching, there must be a threat. I was right about the threat. Yeah, you know what? I'm going to increase that pain to keep that threat and keep that that hyper arousal to what could be going on and how to solve that threat there, because she's responding with that clenching. So sometimes it's like, yes, clenching is a response to pain or a threat, but also it feeds into that response to continue to distribute pain. Okay, so if you have any questions about that so far, feel free to put them into the chat. But we're going to get into some practical strategies. All right, so as we get into this, something that I want to make sure is clear, and I've sort of touched on, but stress is not the same thing as a stressor. So when you have that important stressful meeting or presentation, or maybe it's just to send an email, that's not that's the stressor. That's not the stress. So the stressor is that's what might be, that's the maybe more tangible thing. It's the thing that's creating that potential threat. It's something that can be in your external environment. It can also be in your internal environment, and it activates the stress response. So your stress is neurological. It's physiological. That's the response when facing the stressor. It's your reaction. Your stress response is that reaction to the stressor that's initiating the stress response cycle. And again, this cycle is normal. It's a good thing. We want it. However, we just want to be able to complete that stress response cycle. But the takeaway with this too is just because the stressor passes doesn't mean that the stress passes. We still have to manage responding to that cycle. That's why you might still feel a big impact after a stressor has passed. And also, we can't remove all the stressors from our lives. That's just not something very practical, or even possible, rather. So things are going to come up where we have to respond to threats. It's more so about how are we going to then complete that stress response cycle. First thing, this is kind of always step one, it's awareness. So checking in with the body. Oh, did I notice some tension? Do I notice those butterflies? Do I notice my jaw contracting? Do I notice my shoulders are raised? Do I notice my pelvic floor is contracted? Do I notice that maybe I'm starting to hold my breath? So just noticing those things is a big step one. And this is something that you can take a week to just really practice, especially if it feels maybe like you're not as attuned to what might be going on in your body. And then it's like, okay, after that, all right, what triggered that? How did I respond to that? Am I able to just let that tension go? Or is it more difficult for me to do that? Is it more difficult in certain situations? And just taking note of those things. My logo is technically a cute little butthole. So it is your reminder when you see it to unclench the booty hole, and unclenching the belly. A lot of us are holding our stomachs in, and that can come from a stress response. It can come from societal pressures, and the belly's meant to be a belly, and we want to let that go. Let those organs have space to move. Let the gut have room to function, and not show the brain that we're having this clenching protective response, to show that there isn't a threat. We can let that stuff go. So sometimes we can just tune in and be like, okay, whew, I'm going to let go. Sometimes we might need a little bit extra steps to get there. One other comment with awareness is if you are in the boat of noticing that maybe you're hyper aware, maybe you are always on alert to what is your body feeling. Oh my gosh, I just felt some tension there. Oh my gosh, does that mean that I'm not going to have a bowel movement tomorrow? And then if I don't have a bowel movement, then when am I going to have it the next day? And then I'm probably going to have pain after that. And then I might not be able to attend that event. And now we're kind of spiraling. So there are times where too much awareness can come up. And that's where actually taking a step back and not only approaching the awareness differently, it could be approaching the awareness differently. It could be kind of just dropping that kind of tracking altogether. That really depends on the person and what's going on with you and how we want to approach that. But that can come with a little bit more nuance. But just being mindful if the awareness feels too alert and you're kind of focusing on it all the time and it's more becoming hyper vigilant, then we can start to create more of a stress response from that. Okay, stretches. Stretches are a great way to stretch the pelvic floor, to lengthen the pelvic floor. Um, it's also a time though to just connect with the body. So I can engage in a stretch pretty absent-mindedly, and it might have some impact. It might feel good, but really what we're doing in the stretch is taking time to build that awareness, taking time to focus on our breath, to feel what's happening in the muscles, and to really notice what is going on. I will talk about this more later, but I do have just like a guide for releasing tension. It's like a 30-day plan of releasing tension and working on that stress response. This is a video from there, but this is what a happy baby would look like. And we are going to practice breathing together, but doing breathing in this stretch can be very helpful for your pelvic floor. And slowing down. So how many of you are like, I am working at lightning speed. I'm acting like a lion is chasing me at every second. And I am just like rushing to this, and then I'm doing this, and then I'm like doing the dishes, and I'm doing this very quickly. And a lot of times we just need to like slow it down, because that urgency, when we are acting very urgent like that, it confirms to the brain there's a threat. She's acting really urgently. There must be a threat. I need to keep my guard up. I need to stay alert. I need to not focus on my digestion. I need to like keep creating this pain response. I need to keep these muscles guarded. So just taking time to, I'm going to slow down. We can focus on our senses, and we'll practice this together later too, but really being like, okay, what does this chair feel like that I'm sitting on? Just notice one sense. Oh, it feels really soft. It feels really fuzzy. It feels nice on my fingers. And as I just notice that sense, I'm able to slow down just a little bit more. When doing something like washing your hands, instead of we're just gonna bring that hand washing a little bit slower, a little bit more mindful. And we can really get mindful with our hand washing, where we even are just like, okay, like how does the water feel? What's the temperature? What does this feel like on my skin? And taking time to just let the nervous system notice those sensations and bring you back into your body and let down some of that guard. Diaphragmatic breathing. So this we are going to talk much more about and get into, but breathing strategies in general can help with signaling safety to the body. And nervous system regulation. So this is a very big buzzword, a big term that you might hear thrown around, but it can be a little bit confusing. It's a bit broad, and that's because it does cover a lot. And nervous system regulation can look a world's different of ways. And nervous system regulation also doesn't necessarily mean that you're just like this Zen calm person all the time. It's just a matter of having tools so that we can come back to regulated safety states that could still look active. It could, like, again, remember earlier I was mentioning sympathetic, parasympathetic. We can have safety in both. We can have threat in both. You can be in parasympathetic. So that's kind of like picturing the more like calm, rest and digest, things like that. But if you are feeling immobile, hopeless, you can't do anything or get out of bed, you're feeling kind of task paralysis, that's parasympathetic, but it's parasympathetic with more nervous system threat involved. And sympathetic, we can feel really happy, we can feel playful, we can feel motivated. That is more of an upregulated nervous system, but it's with safety layered on top of it. And so really regulating our nervous system is more so just grabbing that safety and coming to a nervous system where we are not in those polar opposite ends of, I am having a panic attack, I'm experiencing a lot of anger, I'm experiencing just a lot of stress and chronic anxiety when there might not be a threat present, or the opposite end of the spectrum, feeling more of that hopeless defeatedness, maybe depression, things like that. So it's just getting us back into that regulated state. And again, we're going to fluctuate, we're going to move, and that's okay. It's just, can we use tools and come back to at least a general medium ground? And that could look like movement. So nervous system regulation, it's not always deep breathing. It can be doing some jumping jacks, punching the air, doing a big body shake. It can be something that is more active. And sometimes when we're feeling really anxious and really fluttery and like, we might need to do a little bit of movement first before we can even go to a breathing technique. So what helps you can be, it can be different by the person, and it can also be different for you by the day, by the moment, depending on where your nervous system is at. So it's helpful to have these tools so that you can access them as you need, because when we are in these states, it's also harder to access our executive functioning. So it's harder for us to make these decisions and really process and think about things. And so if you practice a certain technique every day, even when you're not feeling dysregulated, now when you're feeling a little bit of that dysregulation, you're able to notice it more. You practice noticing it. You can use that technique and get you back to regulation a little bit more easily. Okay, breath techniques. There's a lot of different ways that you can incorporate the breath. And today we are going to practice the diaphragmatic breathing and vagus nerve strategies. So your vagus nerve is a nerve that is involved in your parasympathetic response, and it is kind of coming from the craniosacral nerves, and it's coming down on the sides of your neck, and it's going into all of your organs from different branches. And when we do techniques that help activate the vagus nerve, we want to activate it. That can help with regulating the nervous system and activating that parasympathetic response. And so we're not going into details of a ton of these right now, but just a couple quick ones would be something like gargling or humming. And the reason why that is helping is because we're vibrating the throat. And when we're vibrating the throat, we are basically giving that nerve a little bit of a massage from the inside. So even something like singing or like doing kind of deep, anything that gets a nice little vibration into the throat. Other vagus nerve strategies could be things like massaging around the ears, down the neck. It can be incorporating cold water onto the skin, and some other techniques with eye movements, lots of different ways. Sensory grounding. We'll practice this together in a moment, but that's kind of what we just talked about with like, oh, I can feel a certain sensation, whether you're hand washing, maybe feeling the chair, and really just noticing the sensations that you feel. Also, drinking water. Just thought of that. Water can signify safety in the brain. So taking a nice cold sip of water can help bring in a little bit of safety. Bilateral stimulation. So that means that we are incorporating both sides of the brain and helping them communicate. This can be listening to music with headphones that's providing some bilateral stimulation. It could be doing some tapping. So like I really love to do crossed arms tapping. And then, so you just tap, 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 tap. And then as you do that, you take your deep breaths. And you feel things start to settle. You might feel yourself yawn. You might feel your jaw let go a little bit. You might feel yourself just sigh, naturally take a bigger breath, and that'll show you you're getting that nice parasympathetic activation. Swaying, so different movement. Can't really see what I'm doing. I can show that again at the end. I can stop sharing my screen there. Oops. So movement, so doing kind of like swaying side to side, that can be really soothing to the body. We can incorporate movement in different ways, but also just getting in some movement, no matter what it is, can really help with regulation. All right, so we are going to do some 5 senses grounding together. So we're going to start. So we're going to do 5 things you can see, 4 things you can touch, 3 things you can hear, 2 you can smell, and 1 you can taste. And it's okay if you don't get the exact number of everything down, just kind of going through some of those senses. So I'm going to say mine out loud. I welcome you to say yours out loud as well. But just kind of taking it at your own pace and going through the senses. So 5 things I can see. I can see a yellow globe light in my office. I can see a rug in front of me and all the little fibers. I can see some dust on the ground. I can see my hands on my legs. I can see my water bottle. I can see my laptop. And this is an example of, I don't remember if I'm on 4 or 5, but you just say whatever you want. I can see a pillow in the distance as well. 4 things you can touch. I can feel my pants under my skin as I have my hands kind of gliding on my pants. I can feel my pelvic model sitting on my lap. I can feel my button up behind my back. I can feel one of the pelvic organs are kind of like stabbing my one foot. I can just now notice that underneath of my foot, on my chair. And just noticing those things that you feel. 3 things you can hear. I can hear the sound of my own voice. I can hear the sound on my pants as my hand kind of glides on my legs. I can hear some gentle meditative music that I have playing in the background. 2 things you can smell, and sometimes these ones are harder, and that's okay. I can smell the air. Maybe you can smell a candle, something nearby, your breath. 1 thing that you can taste. I can taste my saliva, tastes like I'm kind of thirsty. Maybe you have a mint, anything like that. And as you do that, you're helping ground yourself into your body. You're helping tune back in. You're helping yourself not feel as like dissociated or if you're feeling panicked or even just general anxiety or kind of that fast motion response where we're doing this can help slow us down, come into the body and start to let go of that tension a little bit. Some other ways. So this is just some other ways that we might approach that mind-body connection of tension or neuro-based symptoms in the pelvic floor. It can be trigger point release. So trigger point release is where we are applying some tension to an area of a muscle, or sorry, applying some pressure. And we are really doing brain communication with that area and helping communicate and pay attention, letting the brain actually pay attention to that muscle and that specific point and allow it to notice that there is safety there and that it can release some of that tension or release some of that pain response. And in pelvic health, that can be internal and external. Pain reprocessing and neuro reeducation techniques. And so these are techniques that might be a little bit more in depth on the pain reprocessing. And these are things that you would do under the guidance of a pelvic health professional. And with those, you're kind of doing more deeper work of working with those beliefs and those awareness strategies and kind of grading different experiences or activities that might cause your nervous system to rise or cause some of that threat to notice in your body when it is a safe activity. Mental health therapy to help with processing anything deeper that might come up and kind of going into more history-based things with therapy and going into more of that analyzing and processing. Body work. Similar to trigger point release with body work, we're doing brain communication through touch and communicating to muscles, safety with different tension and with release. Yoga is a really great practice where we're incorporating the mind and the body. mindfulness. And this can look like a world of different things. And again, with just completing that stress response, we are just doing something to communicate that safety in the body that we can let go of that response. So, coloring, something that is creative, something that is like kind of repetitive or soothing in that repetitive way. When I say coloring, it is not let me try to think, oh my gosh, what am I going to color? Oh, I don't think this is good enough. Oh my gosh, I'm not a good artist. Okay, this is like looking like shit. It's like, no, no, no. We are just maybe coloring in some boxes. We are being more just kind of like repetitive about it and just kind of going through the motion or getting creative with it. Singing, again, we're also incorporating that vibration with singing. Dancing, we're also getting that movement. Sing and dance with other people, even better. Getting some co regulation, visualizations can be really helpful, and so much more. Okay. So, diaphragmatic breathing. So this is a type of breath that really is working with the diaphragm and the pelvic floor, and we're going to practice some breathing together. Okay, as we practice this, know that everything is always optional. You don't have to engage in this if you don't want to, but if you would like to, you can first just check in with how you're breathing at a baseline. As you sit here, as you breathe, what are you noticing? So, where do you maybe feel the movement of your breath happening? What direction is it going? Where is most of that movement happening? Is anywhere feeling hard to breathe into or restricted anywhere? And if you want to send into the chat anything you notice, you're welcome to. But just taking some time to build that awareness of what that baseline is like. Okay. We are going to be engaging in 360 rib cage expansion. Your diaphragm, it is at your lower rib cage area. And so with your diaphragm, with diaphragmatic breathing, we want to 360 expand that diaphragm. So if you are noticing a lot of that movement into your chest, that can actually cause more of a sympathetic response. It can cause us to use a lot of accessory muscles, can create more tension up here. I'm also doing like a lift and a squeeze with my inhale when I do that, and that kind of pelvic and abdominal region. I want you to kind of actually just scrap that whole imagery of, if you can see my screen right now, of that like inhale where the hands lift up and everything like lifts in with the inhale. We're doing the opposite. Everything is coming down and out and opening. The belly will get expansion. However, if you just focus on the belly, you can kind of neglect the ribs still. So we really want to focus on that lower rib cage region. So you can have your hands on your ribs if that feels comfortable for you. And think of like an umbrella opening and closing. So thinking of your lower rib cage, inhaling, expanding, exhale, just gently returning back down. Might feel opposite to what you're used to. And you're also breathing into that back rib cage and front rib cage. But often we really neglect the side. So really tuning into that side rib cage. Now, as you do this too, start to pay attention to what might be happening with your pelvic floor. Maybe your pelvic floor, you weren't really noticing much, and that's okay. That's noticing, not noticing is something to notice. Maybe it's hard to feel sensations at all. Again, something to notice. Maybe you feel it rise on your inhale. Maybe you feel it lower on your inhale. Just take note Bring that awareness into what's happening with your pelvic floor. Now, your pelvic floor, when we do this breath, when we inhale, the diaphragm is lowering down and the rib cage is opening, everything's expanding. The pelvic floor is going to lower, kind of like two parentheses, your diaphragm and your pelvic floor. So you inhale, your pelvic floor is lowering down on that expansion. It's expanding. That hammock is widening. Your sits bones on the bottom of your pelvic floor are opening. Imagine like a flower is blossoming, opening on that inhale. Your booty hole can be that flower. Blossom that booty hole open. Your exhale, everything's just gently returning to that resting position. We're not contracting, we're not squeezing. Technically, it's a little bit of a contraction, but not in a very mindful contract way. We're just returning. We're just returning everything to baseline on that exhale. Inhale, expanding, exhale, return. Everything inflates and deflates. So why are we doing this? When we breathe in this way, we are incorporating our diaphragm with our pelvic floor. And by the way, if you're nice and stacked, it helps them work together even more. And so when we use them together, it helps us with coordination, it helps us with coordinating how our body even does things like picks something up or uses the core, has stability with the low back. We are also lengthening the pelvic floor. So every one of those breaths and those inhales, you're lengthening and expanding those muscles. You're giving them that release, that expansion. And so when we're just breathing day to day, we want to feel, we want to have them have more of that downward expansion breath. Not that you have to be breathing these deep breaths every moment of the day. We'll have a few that we kind of tune into or when we need them in specific moments, but this is the general direction that we want to take the breath. And it's also helping activate that vagus nerve. And so your vagus nerve is going through your diaphragm. So it's helping with that and helping with regulating your nervous system. So you can take that kind of like that 5 to 10 breaths every like 2 to 3 times a day. You could do like a morning, a midday, and an evening. But working with where you're at and working with your schedule and working with what feels attainable to you. Maybe for you, it just feels like one breath is like, I feel like this is a lot. I just need to do one breath and I'm going to habit stack it. We'll talk about that, practice that in a moment, but habit stack it with making my coffee. And I'm just going to do that. Maybe you are like, whoa, this feels amazing. I already incorporate like this into my day, or I do this already. You know what? I'm gonna do it this many times during the day. We're practicing it though when we don't necessarily need it because we want to make that breath a little bit more habitual. We want to make it a little bit more automatic, and we want to, just as we would with all the other nervous system strategies, practice it so that if we're in times of dysregulation, we can turn to it more easily because we've already practiced it. And it's especially helpful if you are experiencing a pain flare, if you are feeling anxious or stressed when you're initiating that urine stream. So you're helping opening the muscles or finishing a urine stream, trying to settle that strong urge to pee. And there's many other strategies that can go into that, but this is just one of them. Or if you're pooping and you're wanting those muscles to relax to avoid straining. And the push for pooping comes with more nuance, but just the relaxing and releasing part is focusing on this diaphragmatic breath. So I want you to think of, for habit stacking, if you do want to do this breath, ways that you could incorporate it into your day. And this can also be used with any strategies or anything in general that you want to incorporate into your routine. So habit stacking is basically you take a tiny piece of that habit that you want to create and you stack it with something that you are already doing. So that could be something like brushing your teeth. It could be when you're making coffee, eating lunch, something that you are doing daily. And that just helps things feel a little bit more automatic, and then you can build on those habits over time. So you would think of that habit. So right now, kind of think of a daily habit that you might want to add something onto. And I'm just going to use an example of breathing. So maybe you want to have a breath in the morning, take some deep breaths in the morning. So you're like, okay, I always brush my teeth in the morning. I'm going to habit stack it with that. So the small specific goal that we're adding onto the habit is 2 breaths. And the habit is brushing our teeth. So we're keeping it simple, just nice and attainable. And we're also going to get specific with it. So when I say brushing my teeth, I mean I'm about to grab my toothbrush, but I haven't done it yet. I'm in front of my mirror. I'm going to pause and I'm going to take 2 deep diaphragmatic breaths. After I do that, I grab my toothbrush. Next day, I do the same thing. Next day, I do the same thing. And just slowly building those habits. And if you miss a day, that is absolutely okay. If you dropped an egg on the floor, you wouldn't take the whole carton of eggs and just throw it on the floor as well. So if you don't do it one day, that's okay. You just move on. And then you can gradually build that habit. And building it can look like adding on more breaths in that moment, or it can look like adding on now maybe to a new habit you're doing. So maybe it's a lunchtime routine breath, or maybe it is adding in a new habit that you want to engage in completely, like a water goal, drinking water. Okay, so I think I timed that out actually pretty well. If you want to learn more, so the pelvic health ebook just kind of goes over general pelvic health. What are some different pelvic floor symptoms that can come up? Some things that can contribute to your pelvic health. It has some tips in there. It goes over breathing a bit more in depth. So that's free and you can download that. And there's the newsletter. So I have a monthly newsletter that's pretty general. And then I also have a more frequent newsletter related more to sex and intimacy. There's a lot of different blog posts on anxiouspelvis.com. And then I also started a podcast as well. If you want to email me, you can email hello@anxiouspelvis.com. Basically, all my socials are at anxiouspelvis. And I also offer one-on-one coaching. So what that would look like, I do a deep 90-minute dive. And then we create a custom plan based on what your needs are after that. If there's any questions. I'm going to put a sticky note near my toothbrush. Yes, I love that. Sticky notes are wonderful. The thing with sticky notes, so sticky notes are great. If you do that, just notice if like after some time you start to ignore it and it just becomes part of your peripheral, just change up the note, change up the place, change up the color, try a different one, and then bring it back. And then also I just wanted to show the person who maybe couldn't see my screen earlier, I was just tapping back and forth while doing deep breaths. Is anxiety related to pelvic floor tightness and urine leakage while jumping, running? So it can contribute to it, but it doesn't mean that it's the driver. So with running, it can be a lot on the coordination piece. So diaphragmatic breath will actually really help. But then also how we're engaging the TA, the inner core, and how we're engaging in the running and the kind of like quick reaction of the pelvic floor as well to pressure. Yeah. Any other questions? Thank you guys for having me.